Why are the fetal heart strips going to be important in a Maryland birth injury case when we are talking about an injury to the brain? Want to know what I'm getting at here? Stay with me as I share with you this very important information. Hello, I'm Marcus Boston, and I'm a childbirth injury and medical malpractice attorney practicing law here in the state of Maryland, and I would like to quickly talk with you today about the importance of the fetal heart strip when we are talking about a brain injury during birth. Now, the reason why these strips are very important and why your attorney is going to really look at these strips is because what they can do is the fetal heart strips can let you know how well a baby is tolerating a vaginal delivery. In most all of the hospitals now across the United States, the fetal heart monitor is being used, and that, like I said, that monitor is looking at how the fetus is doing during a vaginal delivery. And what can sometimes happen is that if the child is in distress, the strips will identify what's going on with the child. If you have a fetal heart reading that is very, very high, and we're talking about tachycardia here, then the medical professionals, the doctors and the nurses, they have to be very careful, and they have to make sure that they're paying attention as to what's going on. Because again, you don't want the baby's heart rate to be high for too long. On the flip side of that, you don't want the baby's heart rate to be low for a considerable amount of time. Both of these things are going to be looked at when we are talking about a brain injury at birth. Because like I said, the fetal heart monitor is telling the doctors or informing the doctors how well the child is tolerating a vaginal delivery. If the doctors realize and they see that the baby is not tolerating a vaginal delivery well, then they have to take certain types of measures, and with the last measure being an emergency C-section. One of the main reasons why you're paying attention when your child is in distress is because you can be looking at an issue of a lack of oxygen. And when we're talking about a lack of oxygen, you guessed it, that is when you can have an injury to the brain. So why have I taken the time today to talk with you about this really important information? Because I'm trying to give you insight into what goes on if you are thinking about filing a birth injury case here in the state of Maryland. I'm trying to help you see why these fetal heart strips or why the monitor will play a very important role when your attorney is investigating a case like this. If you have more questions about your child's injury at birth, maybe you realize that now, you know what, it's time for me to reach out and talk with someone about what's going on. If you have questions like this and you want to talk with someone, this is what I invite you to do. And remember, taking this next action costs you absolutely nothing. And what is that action, Marcus? It's to go ahead and pick up the phone and give me a call. I can be reached at 301-850-4832, or if you prefer, you can send me an email to medicalinjury@bostonlawllc.com. I answer Maryland medical malpractice and childbirth injury questions just like yours all the time, and I'll be happy to take some time and listen to your story. All right, that's going to be it for today's quick educational video. Again, I'm Marcus Boston, and I'm one of the childbirth injury and medical malpractice attorneys here at Boston Law Group LLC, and we will see you next time. Take care and enjoy the rest of your day.